Okay, welcome to our podcast. This is the Quiet Mom Pots Talk, and we are Zoe and Robin. I usually let Zoe introduce herself. I'm Robin.
I'm Zoe.
And we are here. It's Monday. Happy Monday, everyone. It's been a couple weeks since we've recorded. I know we haven't been as consistent as we've wanted to be, but
we've both been really busy.
We have been
I
really
haven't been feeling super great, and it's been a really stressful time of year with the holidays and work and the seasons changing and daylight savings time and everything else. So
there's a lot going on.
But here we are. We made it.
We made it back. And the last time, if you were listening to us before and you've been following our podcast, you may know that the last time we were here was right before Zoe went to do her autonomic testing. What's it called?
The autonomic testing panel.
So the autonomic testing panel. And that panel included a tilt test.
That's what we're talking about today is the autonomic testing and how it went.
Yes. So the testing, first of all, let's talk about how you felt. Like what was your experience during the testing?
The testing itself was like very draining. They did the breathing testing and that was really hard. I felt really exhausted afterwards. And the second one they did, the one where I was like breathing out for 15 seconds straight, that was like, I don't know how they expected a person to do that. That just seemed, I don't know. I don't know if it's just me being that there's something wrong with me or if that's just like a normal person thing, like breathing out for 15 seconds, keeping it at like a consistent level of breath. I don't even know how to say that, but like
the test, the way the test kind of went is the tester said you have to like exhale. They put this little thing that you breathed into.
Yeah, and it was like hooked up to the machine, and it was weird because it was lit up at the level you were supposed to be at, and then it would show where you are. And you think that would be easy. You think that there wouldn't be any problems with keeping a consistent breath level or whatever, but it's actually a lot harder than you'd expect. Like you get to breathing and it's jumping all over the place and you feel like you're just breathing out.
And so when we went into the room, Zoe was in the room and I went in the room with her, so I was able to watch. But where I was seated in the room was behind where Zoe was at. So they put her like on this hospital bed type thing.
Yeah.
So she laid down on this bed and they hooked all these wires up to her.
It was on the tilt table. So I was laying down for pretty much everything. There was like a part of it where I was part way tilted up and then obviously the tilt table part. But I was laying down for most of it.
So the first part she had to do was some breath tests she was talking about. And then they did this tilt table test where they tilted the table up and then they tested her.
And that part I was miserable. Like you were asking how I was during the test. That part, it was terrible. Like I had so many symptoms. I had the dizziness as I was getting up and like I started seeing stars. I was getting dizzy. Obviously, like I was telling the dude the symptoms the whole time. And so you were hearing everything I was saying. I was getting dizzy, lightheaded. My legs started getting numb. Like up to my knees, my legs were practically numb or like tingling. And my right arm, like my left hand was like hooked into something like out to the side.
You had a blood pressure monitor. And
and I had all sorts of stuff connected to me. But my legs and my right arm were like getting numb throughout the 15 minutes. Yeah. And like I was looking down at my feet and they were like literally probably close to as purple as your shirt is. Not that like vibrant, but that pigment. That's what my feet looked like.
So you had a lot of what you felt was recurrence of symptoms.
Yeah. And I had some chest pain while I was standing up or while I was tilted up or whatever you want to call it.
So what they're measuring in the tilt test is your heart rate and blood pressure. They do some breathing measurements and stuff. But so this...
And then they did this sweat
response test.
Yes.
Did they do that with you standing up too?
No, that one I was back laying down because they laid me back down and then we waited 5 minutes or something. And then he put like the little whatever it was on to activate my
Electrodes
skin
or something? Yeah.
No, it was before that, like the liquid.
Oh, okay.
And then he put the electrodes on. And it was funny because he was saying that it was going to sting, but I had tattoos, so I'd probably be fine. And I don't know why he made the comparison to tattoos because it felt nothing like tattoos. It felt like
because probably some people complain about it stinging.
Yeah, but it felt like a rash. Like, it felt like if somebody was taking a hairdryer and blowing it up against a raw heat rash or something like that.
And you think about that comparison or analogy, this is what it's going to feel like.
Mm-hmm.
I feel like it's the same. It's similar to when you've never had a tattoo and people are like, oh, it feels like constant bee stings, or it feels like this. It feels like that. To me, it feels like a razor cutting into your arm
and to me, it
draw
feels
a
like
picture.
a vibration.
Yeah.
With some needles.
So I think when people are like, oh, it feels like this, it's not like it tastes like chicken. Like everything tastes like chicken. Tattoos feel a little different for everybody.
And
so I just realized
that goes back to everybody's pain sensitivity is different.
Exactly. But so what you did is you had this, they put these electrodes or whatever that stimulated the skin that was supposed to stimulate sweat. And they test.
Which I don't even really know if it was supposed to make me sweat or if it was just something that they would see with like the sensors they had on.
And like, I was thinking the same thing. I was like, are you supposed to sweat or are you not supposed to sweat?
Right.
Are we thinking it's just so basically there was just this menagerie or group of tests that you went in to test for. And is this the only thing that they use to diagnose POTS or
so
what
I actually did some research on that. So the outcome of the test
I was thinking maybe we should go there.
Yeah, the outcome of the test was that I didn't meet the qualifications for a POTS diagnosis or orthostatic hypotension.
According to the results of the test read by the tester. So that's not really an official doctor's diagnosis or lack of diagnosis.
Yeah, and I still haven't heard, like, I didn't meet the physical numbers, like my...
Right, but they've classified as a positive test.
So here's the thing, like, you have to have, I think it's like a 3-minute time frame that your heart has to be elevated by 30 beats a minute or more. My heart was elevated every time that they had checked it by 20 to 25 beats a minute.
So it's supposed to be 30 beats is the threshold, and yours was 20 to 25. Okay.
Yeah, and the 3-minute mark was the threshold, and mine was like 2 to 2.5 minutes.
Okay.
I'm like right there, and since I haven't heard back from the doctors yet, I don't really know what the next steps are.
Yeah.
But as of right now, they're saying I don't fit the criteria.
That report saying
exactly.
You don't fit the
But
criteria.
They didn't have all of the other information of every single symptom that I have ever had. They just had the referral and do the test and whatever else. So honestly, I'm waiting till I see my neurologist on Wednesday because he was the one who ordered the test. He's the one who got the test results, and he'll be able to go over it with me.
Process them.
Yeah. And even if it's not POTS, there's other options of what it could be. Obviously, there's a lot of different conditions that are very similar to POTS that could be a possible situation for me.
Right.
And there's also the possibility of it could be something with my head because of my concussions or something along those lines.
So when you get a test, and this is true with almost any diagnostic test in a lot of different medical fields. Now, I'm going to put this disclaimer that I'm not a doctor and I'm not professing that I can diagnose things or evaluate medical tests or anything else. I do know that there's a lot of conditions that although they have these barriers or these numbers, like these are the criteria to meet a positive or negative diagnosis, there are some people that have that same injury, illness, or condition with high normals or low normals, and they still are officially diagnosed with whatever condition. And this
like
is
I
not
said too, like we've talked about it before. POTS can be diagnosed just because of the symptoms.
Right.
That's a lot of the times how it happens.
A lot.
Yes, the positive tilt table test is automatically going to diagnose you with POTS, but you can still have the same effects of it without meeting that criteria. It's just figuring out if that's what it is or if it's something else that's going on.
Which is why we have doctors. Like we have these tests and we have these testers, like the people who are the experts of how to perform this test.
Mm-hmm.
They read the results and they say, you don't fit the parameters, which you might be one pick off of, or like your case, you're close to those numbers.
Mm-hmm.
When I was younger, I was tested for thyroid condition. And my doctor at the time, he was a doctor that specialized in thyroid conditions. And I had low normal readings. All of the doctors that I've ever worked with have always said, you're normal, go about your way and you're fine. He was like, you're low normal. So let's treat you and see if it gets better. And most of his patients were in that low normal range. He treated them and they got better and it helped. And so for me, we did that. I don't remember exactly what. He put me on metformin. I ended up going off of it because I don't remember why, but whatever. But what I'm saying is, just because you get this thing saying, oh, you didn't meet these parameters, doesn't mean you're like, oh, now what? I'm broken. I can tell that I feel broken.
Wrong.
There's something wrong with me. My body's not functioning the way I expect it to, or the way what I think normal is, or what we think normal is. So now all of a sudden you got this test that says you're not there. It's like going to hurting at a joint, going to get an x-ray for a fact that you broke your ankle because you can't move it. It hurts like hell. You have a bruise, whatever, and you go get an x-ray and they're like, you didn't break anything. You have a torn ligament, or you have a this or a that, or it's just bruised.
Yeah.
That doesn't change the injury that you have to your ankle and that you need crutches and you probably need to immobilize or stop running on it for a while.
Right.
It's just a different diagnosis. And but I can understand, or I feel like I want you to talk about and tell us about that. Like, was there like an emotional roller coaster you went through and you're like, oh my God, now what?
Yeah.
Like, fuck, I've been, sorry, language. I've been planning. I've been working this. I know I'm becoming an expert on this. And now I might not even have this condition.
Yeah.
How was that for you?
One of my coworkers he asked me, is it almost like an identity crisis? And I'm like, yeah, it feels that way because it's like, Chibi, please stop.
Our dog's freaking out.
She doesn't like that we're doing this.
She doesn't like she's not getting attention. Okay, so tell us about like identity crisis. That makes it like.
So I was like processing the whole thing after I got the notification because I didn't even get like a phone call. Haven't heard from a doctor yet. Like I said, waiting till
which is normal for
neurology.
Tests.
Yeah, it is. It's not something I'm like stressed out about or anything like that. But reading that it said does not meet the criteria for postural orthostatic tachycardia syndrome, that was like a big smack in the face. Like, even though you have almost every symptom that this condition has been related to, you don't meet the criteria. And they didn't say I don't have it, but they basically said I don't have it. So it's just difficult to come to terms with because it feels like I'm right back to where I was, right back to the reason that we started this podcast, which is not knowing anything, not understanding where all of this is coming from, why it's happening. But it's like we thought that we found what it was, so I was like relieved and I was prepared and I looked it up and I did my research and I did stuff that should have helped it and I was questioning like, why is this not working? And I'm like, it just needs more time. But maybe that is actually because it's not the real problem. So it's just hard to be like, I don't know, turned right back around and basically back to where I was.
I can understand that. And sometimes it's almost like getting that when you go to the doctor and you get no results, like when you don't know what it is and they're like, oh, you're fine. I'm not fine.
It's
Tell
literally
me
the story of our life.
You don't want to have that condition.
Yep.
And you don't want to be dying or sick, but you want to know what it is. Because if you have that answer of what it is, in theory, you know what you can do to make it better or change it. In the meantime, that's been a couple weeks now.
Mhm.
Have you adjusted your thought process to that and accepted it a little bit, or are you
At
are you
first,
still
I
kind
was
of
like very against doing anything else. I was just
over it?
done. I
Mhm.
was ready to just figure it out on my own,
Mhm.
figure out what helps me, what doesn't help me, and just deal with it, basically. And now I still want to figure out what's wrong because there's so many things that it could be, so many things that I still have wanted to do and haven't done yet, like getting the genetic testing. But it's so hard to keep pushing when it feels like that's all I've been doing because I thought that I was going to get an answer or I
Right.
thought that I had already figured it out.
And you feel like you're chasing your tail.
So it's a process, which is something that I say a lot, but it really is. That's literally the only thing that I can say about it.
And honestly, life is like a process for everything. And you have those days that it's like.
It's funny, in Grey's Anatomy, sorry, I'm obsessed with it right now, but Meredith's mom always says the carousel keeps on turning or the carousel never stops turning or something like that. And it's just so true because you can't get off. You can't escape it. You just
I
have to keep
remember
on going.
growing up, there was a movie that I used to watch, and it was one of my favorite movies, but I was really young, and I don't think I completely understood the movie. I think it was a horror movie or some sort of a scary movie. My parents had me watch movies like Poltergeist and Cujo and this other movie that I don't remember what it was, but it had this carousel thing, which is why I was attracted to it because it was like the merry-go-round. But looking back, I wish I knew the movie. If anybody knows the movie that I'm talking about, which they will not, but that it was in the era
no
of
one
that.
is gonna know that.
But it was, my mom might. But anyways, it was like there was this carousel that kept going and this kid and things maybe started falling off the carousel or whatever. But it was like this every episode or every whatever, the repeating things was the carousel. But it's like that carousel keeps on going. It's like some people use the saying of a Ferris wheel. It just keeps going around and you go back up and you come back down. And that's the reason why when you get into arguments with people, they say, we went rounds on this. Yeah, we go around and around and we don't get anywhere. And we just like, why the F are we doing this again? And so you kind of feel like
boxing rounds. Yes. They're just standing there punching each other for what reason?
What's the point?
Yeah.
So now that you just feel like that,
we're probably going to get some hate for that, but oh well.
About boxing? Whatever.
Probably not here.
I'm not a huge boxing fan.
Me
anyways.
either.
I like this. Okay. When I was younger, I wanted to be a boxer. I wanted to box. I've always wanted to do these random things that like just shock people. Like, you do what?
I have these random moments where I think I could be a police officer or a firefighter or something. But I know that could never happen.
I think you could be that. But
I absolutely think I could not.
And now obviously, what do? I'm like a football referee and I'm trying to like make something of myself in this world. Anyways, but I had lost what was I talking about? Shocking. Oh, we were talking about boxing. But I like boxing. Like, I like the sport. Like, I like kickboxing classes. I like practicing punching.
There's like a reason for that.
I like the fitness about boxing. I don't like the idea of people punching each other in the face until they pass out.
It's one thing if you're like sparring with somebody, but if you're like just...
But you're like
if you're sparring and you have the headgear and everything and it's like safer, like that's understandable. But if you're just sitting there like
for just the sport of it,
bare naked except your shorts and you're hitting somebody in the face over and
for
over just because.
Yeah, I can't. And honestly, like boxing is one thing, but then you add the next level of UFC, and that is like, I remember all of our friends, like my son Theron's a wrestler, and I love wrestling.
Talking to me like I'm some stranger.
I know. Theron's a wrestler, and I like watching wrestling. But like the idea, I've said this since before I had kids. The idea of signing a permission slip for my kid to go be a UFC or do like that UFC type fighting, I don't think I can get there. And even if Theron wanted to go be a UFC type fighter, I would go watch him and I would support him, but I would probably
cringing
be like,
my teeth the whole time.
And I cringe. Like, we used to do UFC parties when you guys were growing up.
Yeah, you and I would do that. I would sit there with you and we'd both just be like,
I would cringe every time. And now I'm a wrestling referee and I do that sometimes. Although this weekend at practice, it was practice rounds. There was 2 probably slams that I should have called that I did not call penalties on. And I feel horrible about them. But sometimes one of the guys like, if it makes you cringe, it's probably illegal. But I'm like, everything makes me cringe. So that's not a good way for me.
No.
So I've learned if they pick them up off the ground and they don't, which I know the rule, if they don't, they have to control them to the ground. So with the practice, what happened this weekend, it was two different ones. One, I'm still not sure that it actually was illegal. The other one, they didn't forcefully throw them to the ground, but they did not control them to the ground. And so I missed that one, and I probably shouldn't have. And it was a girl match. And so then now I feel even more bad because afterwards I was talking to the girl. I just felt bad. Anyways, but it's part of learning, and we're learning.
Yeah.
We're learning. But yeah, I cringe on all of the things. So anyways, where did this? Oh, this was going around and going in circles about getting answers or not having answers.
Mm-hmm.
So what's next?
Next is neurology on Wednesday.
It's this Wednesday?
Yeah.
Okay.
I got really lucky. I had been procrastinating calling the neurologist all week last week.
I don't know if I want to know. I don't know if I
want to
face
last
this.
time I had called them, they were like, we don't have anything until your appointment in February. And that was like a week ago.
Mm-hmm.
So not even a week ago. It was longer than that. But I called them and I was like waiting on hold. And then it had the option to leave a message. And I was like, screw this. I'm leaving a message. I'm about to go into work. So I left a message. Somebody called me back and she was like, I actually have an appointment next Wednesday at 8:05 in the morning if that's not too early. And I'm like, that's actually perfect because that's before work.
That's nice.
So she was like, that's awesome. I saw it and I wanted to get it for somebody. So I got you on the phone. And
that's
I'm like,
awesome.
that's perfect.
So so then you'll have, and that's the doctor, is that the doctor that diagnosed your POTS in the first place?
So he didn't diagnose my POTS in the first place, but he was supportive of the diagnosis and my cardiologist was supportive of the diagnosis. Okay. All of my doctors were very much in agreement. This
makes sense that this is what it should be.
My primary doctor officially diagnosed it last December. But every doctor that I have, my cardio, neuro, physical therapy, everyone was completely in agreement that was the case.
And so let's just briefly go back to the POTS diagnosis process. POTS is one of the ways that they diagnose this. It's a differential diagnosis thing. And what a differential diagnosis means is we cancel out all the other things. Yeah. So like we do blood, and this is true with a lot of different things. And many autoimmune diseases are differential diagnoses. There's not many
really specific ways to diagnose them.
Yes, easily. There's not that many that have a blood test that says, yes, you're positive. And even think about like diabetes, it's not even a blood test that you have diabetes. It's a series of the way your health has been or whatever.
I don't know anything about diabetes.
I don't know that much, but I just know that there's not that many. It's not like you get an x-ray, you have a broken bone. Yes, it's broken. And no, it's not. So a differential diagnosis says, we tested for rheumatoid arthritis. We tested for the things that have markers in your blood. We've tested for other things, structural things, lots of stuff. So differential diagnosis just basically cancels certain things out and then it leaves whatever you're left with. So because it's not all these other things, we think it's probably POTS. However, POTS is one of the things that has a specific test, this autonomic test, kind of, that can assist in the diagnosis. Yeah. What was my question? What's next? Did we answer that question?
Yeah.
So you're talking to your neurologist and then your neurologist will help.
I'll have to go back to cardiology too because they basically said that you're off to the autonomic place now. You don't really need to follow up with us, but obviously
do you have a follow-up
with
the autonomic doctor?
No, I don't. Oh. So I have to contact cardiology, go back and see them too. Probably should go see my primary, but I haven't got that far yet because it's just it's all a lot. Like it's hard because we're supposed to stay on top of our health and call our doctors and go to our appointments and whatever else, but it's so hard when you have multiple providers to follow up with after one thing. Like I was not expecting to have to follow up after this appointment. I was expecting to
just get a confirmation
with the autonomic people, but that wasn't the route that it ended up going. So now I have to figure out what else I can do. And there is like one other condition that I found that has really similar symptoms to POTS, but It's something I think we would have caught with all of the labs I've already had done, but it's obviously something to consider, to ask about at least.
And if it's not something that they're looking for, sometimes those
Right.
get missed because it is not
Exactly.
something that they're looking for until we're like, okay, what else could it be? Oh, I
Yeah.
guess we could have checked this however long ago.
Mm-hmm.
But okay, so what does that mean? I think this is where we'll start to try to leave this and not go forever too much longer.
Yeah.
But what does that mean for our Quiet Mom Pots Talk?
Yeah.
podcast?
That's the hard part is I don't want to leave POTS in the name,
Mm-hmm.
but I want it to still be something meaningful about chronic illness.
Mm-hmm.
And having a chronic illness mom talk just sounds weird.
It's Quiet Mom Pots Talk.
No, it's not, which is sad, but I don't know.
Let's leave it for now because I feel like for now, if there are two reasons. One, because I've shared with a lot of my friends in my network that I have this Quiet Mom Pots Talk. And for the longest time, I wasn't, and I'm still not very good at knowing how to share the link to our podcast. So I'm like, just do a search for our name.
What if we just do Quiet Mom Talks?
We could do that.
I think I like Quiet Mom Talks because instead of Pots Talk, my names
you kind of changed your
are
TikTok.
Zoe's Talks or Zoe's Talk, one or the other,
Zoe
maybe
Talks.
both. Who
Zoe
knows? Talks. But I think that would be good because it's still quiet,
right? And then if we decide that we didn't want to talk about POTS or
we
chronic
can talk
illness,
about
we
anything.
can talk about
it gives us
whatever.
more freedom to just
give us
be
more freedom.
whatever we want.
So I think for now we'll leave the POTS in there just for a little bit.
Yeah.
And then we'll start to phase it out.
We'll start in the new year.
That works. That works. I was on a Zoom call the other day and some of my friends were like, who've never met me before because it was I was my first time in this group. They're like, Robin, are you like a radio DJ? Because it was a Zoom. So I had my headset, my earphones on, and I'm sitting here in our room with this big boom microphone. And they're like, you look all professional, Robin. What do you do for a living? And I'm like, I'm a teacher, but my daughter and I have this podcast. So they asked me, what was the name? And so everybody's like, we'll follow your podcast.
Oh,
so
that's cool.
It was super sweet. So those of you who are there, my women in officiating group, hi guys. Thanks for your support. I appreciate you.
And congratulations. That's awesome to all of them.
Yeah, they are great. I work with a lot of women who are.
I think that's so cool. Like, I always thought that it would be cool to be a ref, but I don't run.
And I think that I think that you would be good and I would have recruited you and I actually did try to. But then as I started in it, I'm like, if she gets run over and hits her head, like with already having the concussions that you've had, there's a chance that it might be not safe for you to do that. But if you wanted to, and you got your doctors, neurologists, and stuff approval, I would be
wear a helmet.
Happy to
That's
bring you on.
That's what Joe would tell me. Joe would tell me to wear a helmet.
No, Joe would probably say you should do wrestling instead. It's safer. Although you can still get kicked in the head. That's happened to me.
Oh, I would totally get kicked in the head. My luck.
So, anyways,
my safest bet would probably be baseball, and even then, I'd get hit in the head with a ball.
Baseball, yeah. Volleyball, maybe.
Oh God, no.
Let me think of the other sports. Volleyball.
Track. Does track have referees?
Track does have officials, but our high schools don't use them.
Oh.
But one of the guys that I work with he came from California and he was like an official starter for track, and you have to have certain tests. And
what about tennis?
Tennis probably does have some officials.
I feel like tennis is too much like of a preppy sport to not have real officials.
Okay, I coached tennis.
That's very true.
I never saw an official. We never had officials, but maybe at tournaments they do, and maybe at the college level they do or something. Yeah. I don't know, but it is a lot of fun, and it's a great. But maybe honestly, a flag football. You should come out and watch the girls' flag this season. It's the only thing that...
but it's so cold.
It is really cold.
It's so cold this year.
That is not the only... girls' flag right now is in the winter. It's a winter sport. But there's flag football year-round at all of the levels. So if you decide that you want to do that, maybe you can. And anybody out listening to us, if you are interested in being an official, most areas are looking for officials in all sports because it's really hard to get officials to commit. It's really hard to get parents to commit to be coaches and volunteer to help. So it's even harder sometimes to get officials. But officials, it's not a bad gig. Like I just bought my husband concert tickets and I spent a lot more money than I normally would have, but I had money saved up from my roughing. I call it it's my hobby that makes me money. It's fun. All right. Okay. That just turned into a little recruitment of officials. So if you're interested, reach out. If you have an opinion on our name, Quiet Mom Pots Talks, Quiet Mom Talks, or any suggestion you might have, let us know. We'll take
either leave a comment, share us the video, send a message on Instagram.
Yeah, all the things. We will
send me a message on Instagram or on TikTok or wherever you're at.
Zoe's new TikTok.
My TikTok is Zoe.
It used to be Pots Talk.
It's Zoe's Talk. The username is Zoe's.talk.
We should try to. We'll try to put a link in our thing. And we should probably start. Oh, we do have an Instagram page. So we'll put it in our bio for Instagram, and we'll also put it on this.
It is in our bio on Instagram.
Okay, so it's in our bio. And we will post. I need to figure out how to post a link in Instagram from our Quiet Mom Pots Talk Instagram to the episodes when we release episodes, but I don't know how to do that. Anyways, so tonight we have tried to be a little bit less
focused.
No, less. We're trying to record live and not have to edit so much so that we can get our content out faster. Mm-hmm. So today was our first trial to do that.
I'm still going to edit this.
We'll probably still edit a little bit. But for the most part, we're going to try to just post it. And I think that it's a little bit more organic. It also helps us it saves us time because it takes a lot of time editing.
Definitely like this better than side by side.
Yeah, I think I do too.
Yeah.
Let us know what you think, whether you like us looking at each other.
Not that they can see us, but
when I post it on YouTube, it posts the video.
Oh, nice. Okay.
So I can post it straight from our recording where we record it.
Yeah.
I can post that on YouTube, but on Buzzsprout, who is what hosts our podcast for all of the things.
Anyways, if you can hear a difference in how we're talking, or if you like it better with us this episode than any of the previous episodes,
100%.
Just let us know.
Give us some feedback. We are
brand new at this.
We're brand new.
So
we haven't taken any classes
or advice or anything.
We bought a bunch of equipment and
struggle with it.
Listen to a podcast to teach us how to do a podcast. And then I still don't know what I'm doing. We don't know what we're doing. So if you have any feedback, we will take the feedback. And I did turn on the web mail or the fan mail in Buzzsprout.
Oh my God, we can get fan mail?
I don't exactly know what that means, but if you're watching it from certain areas, so if you go to our page in Buzzsprout, rather than if you're listening to this through Apple Podcasts or Cast Mobile or whatever the other Spotify, those things, it might not take you directly to that page, but if you can get to, I don't even know how to do fan mail, but
whatever.
Try it.
If we get it, if we don't.
So, and otherwise, send us an Instagram message or comment on our Instagram posts. So share, comment, download. I get notifications like you have X amount of downloads. I think I got, what was the last? Cool. I think the last one I got, you have 50 downloads. So I was like, I think
that's
we
a
hit
lot.
I think we hit 50 in 5 episodes or something like that. So that sounds like a lot. It doesn't sound like a lot to some people that get 50 million on one podcast, but that's fine. We're still new. We don't quite have a road show that we're going to come and do a live show for you yet, but we'll work on it. But anyways, so if you do like us,
dude,
again,
a live
for
show
sure.
would be so cool. We'd be so entertaining, but whatever.
I think that we'd make a good show.
I think so too.
So
we could bring candy, throw candy out to people.
Those are podcast goals for us.
Yes.
We want to be a podcast goals that goes on the road.
So share the word with all of your friends, all of your mother-daughter duos exactly. And your best friends. Bestie. Because honestly, my mom is basically my best friend. I have, other than you, one friend.
You probably have more friends than you think.
No, I legitimately have one friend. I have coworkers, and then I have my boyfriend and my brother, and then I have one friend. and you. But it's great. I kind of like it.
That's nice. Everybody, yeah. Small circles are not bad as long as it's not the size of your circle. It is the quality of character.
Quality
or
over
something.
quantity.
Yes. Okay. So if you like, download, share, do all the things to help our algorithms.
Yeah.
We appreciate that. We will see you back here next week after Zoe sees her doctor, and we'll report back on what the doctor said, and we'll go from there. If you are interested, if you have any questions about autonomic disease or POTS or dysautonomia in any way, shape, or form, feel free to somehow reach out to us. If there's something that you want us to cover, we can start looking at that. We can start looking in the future into the new year of things that we can guide our podcast in a way that will work for everybody.
And if anyone has any smaller questions or things that they want covered, feel free to send me a message on TikTok and I can make a video about it, give you some more feedback. I'm happy to answer all the questions. Because I did all of the research, and obviously now it might not be necessary for me, but I can help you.
Help people out. You're still here to help people.
Yeah.
Just because you might not have the same diagnosis, you can still have the purpose to help. It's about the intention. So I'm wearing my "It's okay to not be okay,"
and I'm wearing a green sweatshirt.
So that's one thing that we talk about a lot, is that sometimes you're just not okay. And I know that Zoe went through a little bit of a phase after her test that maybe she was not okay for a little bit, but we all have those days. We all have those moments. We're here for you. Thank you for sharing your evening with us. We will talk to you soon. Have a really good night.
Yeah.
Bye, guys.